bulbs put out. And if you can find a tanning salon that uses those sorts of bulbs, those are great because they're going to minimize your risk of tanning actually, but you'll still get some color. They're going to maximize your risk of vitamin D production. So that's kind of where you got to kind of do a little research and find on your own. Definitely the best way to get the vitamin D is through production through your skin using UVB rays, which a tanning bed will do for you, but depending on the bed itself is how much, how fast, kind of thing.
Is there anything that will screen out the A from the sun and let the B?
That's an excellent question. I've thought about that. I don't know of anything that they use. I think because any filter that you use, because I mean the types are very similar, I guess, that they really don't have a screen method for it. But if you use the safe tanning lights that you can buy, I guess they really don't. I guess just that, you know, because they kind of maximize the UVB, so they might get you up to 20% UVB. They drop the UVA down to 80%. I guess just that switch makes a world of difference for your risk of burning while using these lights. You know, just that little bit of difference decreases your risk of sunburn and irritation of skin. And then also if you don't use them for as long, people tan sometimes for too long. They'll go and sit in those machines for 15, 20 minutes. You know, when you're getting whole body sun like that, you could probably do 2 minutes, 3 minutes, an hour. And that might be enough to get your levels to where they need to be. Especially before you get, if you get a little bit of a base tan going in, then you can handle a little longer.
What's the difference between vitamin D2 and 3?
Vitamin D2. Vitamin D2 actually has to be metabolized by your body and then turned into vitamin D3 for your body to use. Vitamin D3 is a type of vitamin D that your body uses. Vitamin D2 is actually like a plant sterol. It's made by plants, and so bodies don't utilize it quite as well, and thus it becomes toxic in our system a lot quicker. So I would stay away from vitamin D2.
It was put on 50,000 units.
D2? Yeah, I would switch that to D3, and they do that because it's cheaper to produce. And it's something you want to talk to your doctor about and say, hey, I'd rather be on vitamin D3. It can quicker, yeah. And other thing, and not so much that it may become toxic, it doesn't work as well. They don't see the results with D2 as well as they see with D3 because your body has to metabolize it. It has to change it. So it's doing a lot of extra work to change this D2 into D3, which you really don't need to be doing. It's kind of senseless. Why would you do the work when you can have the pill making company do it for us? And both of them are relative. D3 is relatively cheap as well too.
What's the difference between an ultraviolet light and a tanning bed?
Nothing.
Nothing?
That's exactly that's tanning bed, that's what they produce.
Right, so you can just go in your basement and buy an ultraviolet light for your plants and stuff if you're growing plants. And
we kind of talked about that before. There's two different types of UV light. You have UVA and UVB. You have to see how much of each that light produces, and there should be like a spec readout on that bulb to tell you how much is producing of each. Because plants, if you're using a plant light, that will help with some forms of depression to quash that. But as far as vitamin D production, it may not produce the amount of vitamin D that you necessarily want. Because it may be producing a lot more UVA. That certain types of plant, they may not really need the UVB because they may just need UVA, so that might be what it's producing. Typically the bulbs that produce the higher levels of UVB tend to be more expensive.
The other question I got is that 15 minutes a day, 15 minutes a week?
That depends as well too, but you can safely, and that's the nice thing about using those types of things is as long as you're not burning yourself, your body will self-regulate that. You can't, like through sunlight, you can't overdo it, other than burning yourself, getting sunburned. If you're just in the sun, your body will turn off the juice when it's made enough. Usually it's around 20,000 IU. It'll kind of down-regulate it. It'll turn off the system. You won't make more than you need. That's why if you just get it from the sun, you really don't have to check your levels or do anything because it's not going to be an issue. You won't OD on it. But if you're going to do it by taking an oral supplement, it's something that you're gonna wanna have monitored. Not that there's a huge risk, I mean, the risk it's kinda up there, but, I mean, there's always a risk with any type of medical treatment, some risk, so.